My name is Dr. Jacob Matz. I am an orthopedic surgeon working in St. John, New Brunswick. Ankle arthritis is a painful condition where the normal cartilage that lines the ankle joint has worn away, and instead there is bone rubbing on bone. This leads to debilitating pain and swelling in the ankle joint, which can substantially affect a person's quality of life and impact their ability to carry out even basic daily tasks, such as standing or walking. Total ankle replacement is a life-changing operation which aims to alleviate the pain associated with ankle arthritis. We are currently using 4th-generation ankle replacements, which have shown promising results and impressive durability.
Research shows patients receive the best care when they are active participants. By choosing to have an elective joint replacement, you agree you will do everything you can to optimize your recovery. This means reviewing the education material, practicing the exercises we will review in this online class, preparing your home before you come to hospital, and arranging a ride home from the hospital. You will also be responsible for arranging for equipment before your surgery, and members of our healthcare team can help with that. We recommend you select a friend or family member to be your partner in care, someone who will be prepared to help you when you are most vulnerable. This might include assisting you with personal hygiene activities after your surgery when you are at home. As this is an elective surgery, we need you to be in optimal health before your operation. In the rare event that you have a medical emergency during your hospitalization, sometimes called a code blue, you may have specific wishes about how you want the team to handle your care. We can explore your values and goals while explaining the risks, benefits, and realistic outcomes of resuscitation. This conversation can include your partner in care and primary care provider. If you are waiting to see a specialist regarding a separate medical condition that may impact your recovery, we recommend you see them before surgery. If you have any dental concerns, please see your dentist before surgery and maintain good oral hygiene following your joint replacement. Any unhealed sores or abnormal skin changes may delay your surgical date and should be reported to your surgeon. If you smoke or vape, we recommend you reduce or quit smoking prior to your surgery, as nicotine delays healing and increases your risk of joint infection. We can provide you with resources in the hospital, but if you have not yet received a date for your surgery, you can contact Go Smoke Free NB for resources on quitting. The nurse associate can provide you with an outpatient prescription for nicotine replacement therapy should you wish to quit or reduce smoking prior to your surgery. Please contact their office for more information. Washing your hands and asking people around you to clean their hands will also help to reduce your risk of infection after surgery. At Horizon, we invite patients to politely ask healthcare workers to clean their hands before they touch you. Please remind your family and other visitors to clean their hands and to avoid visiting if they feel unwell or have cold or flu symptoms. Before your surgery, you will have an appointment in the preoperative clinic, or a staff member will telephone you to get information needed for surgery. At this appointment, members of the healthcare team will review your health history, and you may have additional tests such as blood work, an X-ray, or an ECG. If you have a complex medical history, you will be seen by an anesthesiologist in the pre-op clinic. Since your anesthesiologist is responsible for the overall care during the operation, they want to ensure that they are optimized for this elective procedure. When you go to the pre-op assessment clinic, please bring all of your home medications in their original bottles. Be sure to bring all medications that you take on a regular basis. Please include all tablets, capsules, creams, puffers, patches, eye drops, and injections that you take regularly. We also ask you to bring any over-the-counter medications such as vitamins, minerals, and supplements. We will make a list of your medications. This list will form part of your post-operative orders that your surgeon will order after your surgery. When packing for the hospital, we recommend you bring 2 or 3 pairs of loose-fitting clothing and personal care items that are scent-free. We recommend you pack supportive footwear for the non-operative foot that includes a back and can accommodate swelling. If you wear a sleep machine called a CPAP, you must bring that on the day of your surgery. If you wear dentures or glasses, we recommend you bring them in their case. You do not need to bring mobility aids with you, as these will be provided during your hospital stay. You should not bring a large amount of money, jewelry, or expensive clothing with you to the hospital. We suggest that no more than $10 be kept at your bedside. For your convenience, ATM machines are available at the hospital. You are welcome to bring electronic devices such as mobile phones to communicate with your friends and family. However, the hospital assumes no responsibility for loss or damage to your personal property. On the day of surgery, please take your medications as directed from your surgeon or the nurse in the pre-op clinic. Depending on the facility where you are having surgery, on the day of your surgery, you will register at admitting or in the day surgery department. These instructions will be given to you at your pre-admission clinic visit. Please bring all of your home medications with you again. The nurse in day surgery will review your home medications once more and complete a health assessment. You will also have an opportunity to speak with your surgeon and the anesthesiologist who will be giving you medication during the surgery. A nurse from the operating room will introduce themselves and ask you questions for a pre-op checklist. The nurse will accompany you to the operating room. We will start an IV and may give you additional medications prior to your surgery. There are several options to prevent pain and put you in a sleep-like state for your surgery. Depending on your medical history, previous surgeries, and allergies, we will discuss the anesthetic plan that is right for you. You may be offered a spinal anesthetic, which means a small needle will be inserted into your back, and anesthetic injected. You'll be frozen from your belly button down for 2 to 6 hours. You can choose to be awake and aware during the surgery, or you can request some sedation. If a general anesthetic is offered, this means you'll be going to sleep for the surgery. A nerve block may also be available as a form of pain management after surgery. Your anesthesiologist will discuss these options in more detail on the day of your surgery. Once your healthcare team is ready, you will be brought to the operating room and assisted onto the operating table. Patients will receive a warm blanket to make them more comfortable. The healthcare team will do a final safety check before you are put to sleep. The length of surgery varies in time from 2 to 4 hours. The length of time depends on the complexity of the case. During your operation, your family is welcome to stay in the waiting room, and a member of the operating team can give them an update when your surgery is complete. Family may also receive updates from the front desk at the operating room if needed. After your surgery, you will be moved from the operating room to the recovery room as you wake up from surgery. The time you spend in the recovery unit may vary depending on how long it takes you to wake up, and bed availability on the inpatient unit. After you leave the recovery unit, you will be moved to the inpatient orthopedic unit, where registered nurses and licensed practical nurses will be caring for you. Your family are welcome to visit you after the nurse has completed their initial assessment. The night of your surgery, we will be encouraging you to stand up with help. Every day following your surgery, you will be expected to walk with the assistance of your care team. Safety is very important to us, so please remember that after surgery, you will need assistance mobilizing until your care team tells you that you are safe to do so on your own. You will not be allowed to put any weight on your operative foot for 4 weeks. Do not walk on your operative foot until your doctor tells you it is safe. Doing so too early can damage the operation and lead to serious complications. Even though you will be non-weight bearing, this does not mean that you should lie in bed all day. Do not try to get out of bed by yourself, as you are at risk for falls. There will be a call bell at your bedside, and we always want you to push the call bell instead of getting out of bed on your own. The nursing staff on the inpatient unit will be happy to provide updates to your family, but for confidentiality reasons, we can only provide the information to your designated next of kin. Horizon Health Network recognizes that family and friends are an important part of the recovery process. Your partner in care is welcome 24 hours a day. However, we do ask that family and friends coordinate their visit with the patient care team, and the number of visitors may be limited due to space and consideration of other patients. Adequate pain control will be a priority after your surgery because it directly affects your recovery. Patients experiencing severe pain cannot take deep breaths or complete their post-operative physio. The nurses can increase and decrease the amount of pain medications you are taking based on your pain level, so it is important for you to communicate how you are feeling. Ask for pain medication before you become too uncomfortable. Do not let your pain get to the point where you need pain medicine immediately. It is harder to ease pain once it is unbearable. Tell us if your pain is not getting better with the pain medication we give you. Tell us if you are experiencing drowsiness, dizziness, nausea, or itchiness. Nausea can negatively impact your recovery, and the nurses can treat it if you tell them. Some patients are afraid to take pain medications after surgery because they are worried about becoming addicted to pain medication. We use the lowest possible dose for the shortest possible time. As you heal, your surgical pain will decrease and your need for pain medication will decrease too. During your hospital stay, the nurses will be monitoring your dressing and will give you instructions on how to look after your dressing. Once you are discharged home, you do not need a nurse to look after your incision, but remember to keep your dressing clean and dry. Always wash your hands if you'll be touching the area around the incision. Your physician will see you 3 weeks after your surgery to remove your dressing and take out your staples. We encourage you to have your first shower while you are in hospital, as your mobility will have changed. Use 2 layers of plastic or purchase waterproof shields to keep your dressing dry while you bathe. Even with protection, never put the dressing under water. We recommend that you sponge bath if you cannot keep the area dry during showers. Factors that determine when you are ready for discharge include when your vital signs are stable and your pain is well managed, when you're able to get in and out of bed independently or with minimal assistance, when you can walk a realistic distance and climb stairs safely if you have stairs at home. When you are admitted, we will discuss your expected date of discharge with you. The estimated length of stay for this surgery is 1 day. You will be responsible for arranging a ride home from the hospital, as you will not be allowed to drive immediately following surgery. Finally, you may need extra help at home with activities such as meal prep, laundry, yard maintenance, or arranging drives for your medical appointments. We advise you to make these arrangements prior to your surgery. Leading up to your surgery, it is important to exercise daily. This will help you to recover more easily from your surgery. We recommend choosing an exercise that you enjoy, like walking, a stationary bike, or swimming. You should begin slowly for 5 to 10 minutes if this is new to you, and gradually progress so that you are able to exercise a minimum of 20 to 30 minutes 3 times or more every week. We will review the exercises that you will be doing after your surgery. We encourage you to start doing them now to start building your strength. Learning and practicing these exercises will help you prepare for surgery and recover after surgery. We encourage you to work on these exercises with both of your legs, both before and after surgery. The first 2 gentle range of motion exercises should be done about 3 times per day in the post-operative phase. The remaining strengthening exercises should be completed once a day, starting with 1 set and working up to 3 sets of 10 to 15 repetitions. It is normal that you may experience some pain and soreness when you start these exercises. If you are experiencing a lot of pain, you may need to start with fewer repetitions and consider taking pain medication as prescribed prior to your exercises. It is also recommended to not do these exercises within the 2 hours before you plan to go to bed so that it does not affect your sleep. After surgery, it's normal for pain to interfere with your sleep. You can nap during the day to compensate for the sleep you are not getting at night. Heel slides. First, we have an exercise for gentle range of motion. Lying on your back with your legs out straight, slide 1 heel up toward your buttocks. Hold for 3 seconds, then slide the legs straight again. Relax and repeat. Hip flexion. The second exercise helps stretch your hips. Lying on your back with your legs out straight, pull 1 knee up towards your chest. Hold for 3 seconds, then return to the starting position. Relax and repeat. Dead bug. The dead bug exercise works your core or abdominal muscles. Lie on your back with your knees and hips bent to 90 degrees and both arms vertical. Brace your core by lightly pressing your back into the bed or floor. Slowly and with control, lower 1 leg and the opposing arm as far as you can go before your back starts to lift from the bed or floor. Slowly and with control, return to the starting position and repeat with the opposite arm and leg. Straight leg raise. The straight leg raise helps to strengthen the muscles on the front of your thigh. Bend 1 knee and keep the other leg straight. Ensure not to put weight through your operated foot, but it can rest lightly on the bed during this exercise, or you can keep your operated leg straight when working the other side. Tighten the muscles above your knee to keep your leg fully extended and lift it up 6 inches or 15 centimeters from the bed. Hold for 3 seconds, then slowly lower your leg. Try to keep your core lightly braced so that your back does not arch as you lift your leg. Relax and repeat. Glute squeeze. This next exercise works your buttock muscles. Lying on your back, squeeze your glutes or buttock muscles together. Hold for 3 seconds, then relax and repeat. Supine clamshells. Supine clamshells are a strengthening exercise for your hips. Lie on your back with your knees bent and a resistance band around your knees. Slowly and with control, push your knees apart against the resistance, keeping your feet together. Hold for 3 seconds and then return to start with control. Relax and repeat. Side lying hip abduction. The next exercise works the muscles on the outside of your hips. Lie on your side with the bottom leg bent. Lift your top leg up and slightly back. Keep your foot parallel to the ground and try not to let the leg come forward as you lift. Hold for 3 seconds, then lower the leg with control. Relax and repeat. Side lying hip adduction. For the next exercise, you will remain lying on your side to work the muscles of your inner thigh. Bend your top leg, resting the foot either behind or in front of the bottom knee. Again, ensure you don't put weight through your operated foot when in this position. From here, lift your bottom leg up a few inches off of the bed. Hold for 3 seconds, then slowly lower. Relax and repeat. Prone hip extension. This exercise works your glute or buttock muscles. Lie on your belly with one knee bent as much as you can. Gently brace your core muscles and try not to arch your back or move your pelvis as you squeeze your glutes and lift the bent leg off the bed or floor. Hold for 3 seconds, then lower with control. Relax and repeat. Seated knee extension. Your last exercise works the muscles on the front of the thigh. Sitting in a chair, kick one leg out straight, focusing on squeezing those thigh muscles. Hold for 3 seconds, then lower with control. Relax and repeat. You can add a resistance band tied to the back of the chair and your ankle for resistance if it feels too easy. Swelling in your ankle is normal after surgery. The swelling will gradually decrease after surgery, but it is important to treat, especially with rest and elevation in the immediate post-operative phase. Prop your foot up on pillows or another support at the level of your heart. Think toes above the nose. Be sure to keep your dressing dry when applying ice. It is recommended to elevate the ankle for 50 minutes or more per hour, with no more than 2 hours a day out of the elevated position until following up with your surgeon. You may also ice the ankle several times per day for 15 minutes maximum to help control the pain and swelling. For example, lie down on your bed with pillows under the lower half of your leg. Sleeping on your back with your leg elevated is recommended. If you are not able to sleep in this position, try lying on your side with a pillow between your knees. Sleeping with your operated leg closest to the edge of the bed protects it from being bumped if you sleep with a partner. After ankle replacement surgery, you will be expected to go to your local hospital for outpatient therapy, so make sure you have arrangements for someone to drive you once or twice a week for at least 4 to 6 weeks. It is not standard practice for extramural physiotherapists to visit you at home if you have had an ankle replacement. If you have private coverage, you may see a physiotherapist at a clinic or arrange for one to come to your home instead. We suggest making your first appointment for a week or 2 after your surgical date. After your surgery, you'll need equipment to move around, at least for the first few weeks. We will provide this equipment while you are in the hospital, but it is your responsibility to arrange for the equipment at your home. We will show you the proper way to move following your ankle replacement. When using a walker, you should always have proper fitting footwear on and not be in sock feet. The walker height needs to be adjusted to fit your body. Standing with both arms at your side, the top of the hand grip should line up with the crease on the inside of your wrist. After your surgery, you will not be able to put weight through your operated ankle. To mobilize with the walker, you will move the walker about 1 step forward, holding on for balance, with your weight on your unoperated leg. As you push through the hand grips with both arms, this will assist you to hop or shuffle your unoperated foot forward to move. You should continue to use your walker until your physiotherapist progresses your mobility. Since you won't be able to put weight through your operated ankle, you will be required to either hop up and down the stairs or to sit and bum up and down if hopping is not a safe option. Hopping requires strength in your unoperated leg, but you can use a sturdy stair railing with crutches or a cane to assist you. If you have no handrail, it is recommended to lower yourself into sitting and use your unoperated leg and your arms to navigate the stairs. If you have a sturdy railing running the whole length of the stairwell, you can place one or both crutches under one arm and hold the rail with the opposite arm, or hold a cane in one hand and the railing in the other. Hop up with the healthy leg first, then follow with the crutches or cane. When going downstairs, place the crutch or cane on the lower step. Hold the operative leg out in front of you, then slowly hop to lower yourself down to the next step. The environment you plan on living in after you are discharged from hospital may require some temporary changes so that you are able to move easily and comfortably. We recommend you make any adjustments to your home before going in for surgery, as it may be difficult to do afterward. Some examples include temporarily setting up your living space on one level after discharge, preferably on the ground level if possible. This may require moving furniture, like bringing a bed to the level you intend to stay on, or putting in a commode temporarily if there is no access to a bathroom on that level. Another recommendation is to install handrails or purchase equipment to assist you on any stairs in your home. We recommend removing clutter on the floors, including loose rugs, carpeting, or electrical cords that could cause you to fall. Lastly, consider rearranging furniture to provide more space to accommodate your walking aids. To help with comfort, independence, and function, we recommend placing items you use frequently on surfaces between your shoulder and hip height. For example, leave plates and glasses on the kitchen counter or on your dinner table to avoid reaching in high and low cupboards. In the bathroom, set up frequently used items on the vanity and ensure that shampoo and other needed items are within reach while bathing. Eating healthy is important after surgery to help the healing process. You may be too fatigued to cook nutritious meals after surgery, so we encourage you to prepare meals in advance and freezing them, arrange for someone to prepare your meals, or you may want to consider calling services like Meals on Wheels if it is available in your area. If you are still working, you will need to make arrangements for taking time off work during the recovery period, which varies depending on the individual and type of work done. Speak to your surgeon for necessary support and documentation. If you are a caregiver for a family member or friend, alternate care should be arranged temporarily for that person. Also, pet care after surgery may be difficult and you may require assistance from family, friends, or boarding facilities. We recommend completing errands and grocery shopping prior to your surgery. When you come home from the hospital, you will need help with laundry, groceries, and house cleaning. Depending on the time of year, you may have to make arrangements for home maintenance, such as snow removal or lawn mowing. Now we want to review some of the modifications to daily activities and equipment suggestions you may need to consider after your surgery. We encourage you to practice these activities as demonstrated in this video before you have your surgery. It's important to take pressure off your new ankle while sitting. The best chair to use after surgery is one with a sturdy back and armrests. Ensure the chair is about 2 inches above knee level. If the surface is too low, use a high-density foam cushion or bed blocks to raise it. Sitting on higher, firm surfaces makes it easier to get in and out of chairs or beds without putting stress on your ankle. To sit, back up to the chair until it's against your legs. Keep your surgical leg extended in front of you, reach back for the armrests, and slowly lower yourself onto the chair, ensuring your hips stay higher than your knees. To stand up, slide your hips to the edge of the chair, extend your surgical leg out in front, and push up using the armrests and your good leg, avoiding putting weight on the surgical ankle. If you are up frequently at night or have a long distance to travel to get to your bathroom, you may want to consider using a stationary commode next to the bed. Something to keep in mind is that you may be at an increased risk for falls at night because of decreased alertness and reaction time. Please consider nighttime lighting and ensure you have a clear pathway to the bathroom at all times. Following your ankle replacement, it is not recommended to submerge your incision in water until it has fully healed. Recommended forms of bathing after your surgery include sponge bathing at a sink. This option should be considered if you are not feeling well enough to use a shower. It is important to note that you must keep your dressing dry at all times. Use 2 layers of plastic or purchase waterproof shields to keep your dressing dry while you bathe. Even with protection, never put the dressing underwater. We recommend that you sponge bath if you cannot keep the area dry during showers. If you are using a walk-in shower stall, a shower chair may be useful to avoid putting any weight on your new joint and to help reduce fatigue. If using a bathtub shower, a transfer bench is useful to help you get in and out of the tub. A non-slip bath mat is encouraged both inside and outside of the shower to reduce the risk of falling. You're not permitted to drive until you receive medical clearance from your surgeon. Speak to your surgeon to know if there are any restrictions in traveling in a vehicle for the first 6 weeks after your ankle surgery. It is your responsibility to get equipment for your home prior to your surgery. We recommend practicing with the equipment before your surgery. Provincial Medicare does not cover home healthcare equipment. You are highly encouraged to investigate what you are eligible for through your private insurance plan. Some policies may cover a portion of the cost. If you are covered, you may require an equipment prescription to be filled out by your doctor or physiotherapist. Most equipment is adjustable and can be borrowed from friends or family. Equipment is available at any medical supply store and pharmacy. Loaning equipment from Red Cross is free of charge, but equipment is limited and there may be a wait list for various items. A pharmacist works to ensure you are on the right medications. We also want to provide you with information on blood thinners, a medication you'll be taking after your surgery to reduce your risk of developing a blood clot. There's a risk of blood clot formation after an ankle replacement due to the expected tissue damage after surgery and the fact that you will be less active. Some patients also have a history of blood clots or clotting disorders that may increase the risk of the post-operative blood clot. After you leave the hospital, it is important to know the signs and symptoms of a blood clot. The symptoms could include chest pain, lightheadedness, shortness of breath or out of breath, leg warmth or tenderness, leg swelling, leg pain. It is important to note that the leg tenderness feels different than the tenderness from your surgery. If you experience these symptoms post-operatively, don't delay seeking medical attention. Go to your nearest hospital or health center and be sure to tell them that you've recently had an ankle replacement. To reduce the risk of a blood clot from occurring, the hospital will provide you with a blood thinner, and this medication should be continued after you leave the hospital for the duration specified by your doctor. The choice of which anticoagulant that you will take depends on your other medical conditions, allergies, kidney function, and any drug interactions that might occur. It's important to note that these medications only do their job if you take them as prescribed. Upon discharge, you will be given a prescription for the balance of remaining days of your therapy. It is important that you take this prescription to your drugstore and fill it as soon as possible. It is extremely important that you do not miss any doses of your blood clot preventing medication. If you experience any issues with coverage for your blood thinner, please contact your surgeon as soon as possible and do not delay starting treatment. Some patients may already be taking medications to prevent blood clots for a medical condition. If you are, you will receive specific instructions on how to take them before and after your surgery. All medications that prevent blood clots can sometimes cause bleeding. Be careful after your surgery to avoid any activities that may cause bruising or bleeding. You may also experience extra bleeding after a cut, from a nosebleed, or even when brushing your teeth. Sudden changes in the color of your urine or bowel movements may indicate bleeding. You should seek medical attention if this occurs. It is important to note that there will be a slight change in your bowel movements if you are taking iron pills. Some natural health products and anti-inflammatories affect blood clotting and can interact with your blood thinner. Please speak with your surgeon or the pre-assessment clinic nurse if you are taking any of these medications. If you have any questions about your blood thinner, please ask your pharmacist. Patients undergoing joint replacement usually do not see dietitians while they are in the hospital, but we want to provide you with information on proper nutrition before and after surgery to help with your recovery. Did you know that surgery is a major trauma for your body? Proper nutrition will reduce your risk of post-operative infections. Having a healthy body weight will also decrease stress to your joints caused by extra weight. If your doctor recommended weight loss, please talk to a healthcare professional about a weight loss program. Extreme dieting is not recommended before surgery as it can delay wound healing. Before and after surgery, we want you to focus on a healthy diet with enough calories, protein, and fiber to help with your recovery. If you have other health conditions that require a specialized diet, please speak with your dietitian or healthcare provider before making any changes. Canada's Food Guide provides information on general healthy eating. You can visit their website to learn more. After surgery, a diet that includes healthy, nutritious foods is important as you need to eat enough calories and nutrients to keep your recovery on track. In order to eat enough calories, aim to eat 3 meals each day. If you find the meals in the hospital are too small, you can ask for larger portions. If you are still hungry or find you are eating less than you usually do, feel free to have extra snacks. There's a kitchenette on each unit that is stocked with some basic food items and drinks. Protein is an important nutrient after surgery because it is the building block of all tissues in the body. Protein also helps us heal and helps our bodies fight infections. After surgery, we need more protein, and if an infection develops, our needs increase even more. To make sure you get enough, choose a high-protein food at each meal and snack. Fiber, fluid, and iron are also important nutrients after surgery. Please see your surgery booklet for more information. If you are interested in learning more, feel free to speak with a dietitian while you are in the hospital. You can also reach out to dietitians in the community by asking your family doctor for local resources or by contacting a local outpatient dietitian in your region. After being discharged home, you should seek medical care if you have increasing, severe pain, if you're not responsive to an analgesic, if your temperature is greater than 38 degrees Celsius, or if there's an increase in the drainage from your wound.
We hope you have found the information in this video helpful. If you have further questions related to this video or your upcoming surgery, please contact your local orthopedic unit or your orthopedic surgeon. On behalf of the orthopedic team at Horizon Health Network, we look forward to working with you for your upcoming surgery.